Assalamualaikum warahmatullahi wabarakatuh, and my name is Mama Azmi, and I'm here to speak about my introduction about the effect of plastic surgery on teenagers. When you hear about the plastic surgery, what do you think of? A Hollywood star trying to delay the effects of aging, or the people who want to change the size of their stomachs, breast, or the other body parts? What is plastic surgery? Just because the name includes the word plastic, that doesn't mean patients who have this surgery end up with a face full of fake stuff. The name isn't taken from the synthetic substance, but from the Greek word plastikos, which means to form or mold. Plastic surgery is a special type of surgery that can change a person's appearance and ability to function. There are two. The first one is reconstructive procedures correct defects on the face or body. This includes physical birth defects like lips and palates and ears deformities, injuries like those from dog bites or burns, or the aftermath of disease treatments like rebuilding a woman's breast after surgery from the breast cancer. The second one is cosmetic. The procedure alters part of the body that the person is not satisfied with. The common cosmetic procedures including making the breast larger, it's called augmentation mammoplasty, or smaller, reduction mammoplasty, reshaping the nose, and removing pockets of fat from the specific spots on the body, it's called liposuction. Some cosmetic procedures aren't even surgical in the way that most people think of the surgery, that is stitching and cutting. For example, the use of the special lasers to remove unwanted hair and sanding skin to improve severe scarring are two such treatments. That's all for my introductions.
Hi madam, I'm Madhunisha UDE section 3. Today I'm going to talk about benefit and negative effect of plastic surgery on teenagers. Benefit of plastic surgery is that increased self-confidence. Studies have shown the surgery can increase your self-confidence and your self-esteem as well as overall satisfaction of life. I have three negative of plastic surgery on teenager. First one appearance, huge expense, and last one is addiction. Appearance is one of the most unlikable disadvantage of cosmetic surgery is unwanted scars. These hypertrophic scars are always quite prominent and they are broad and reddish. In many cases, the patient find that surgery has not given them to desired result and have made their face look horrible. And that huge expense. Huge expense is the cost associated with those surgery is extremely high. This horrific story does not end off. This price is only for surgery. The fees is for the doctor, hospital, and the additional expense. Teen needs to consider all those costs before going for the surgery. Lastly, addiction. Teenagers are not sure about the ever-growing and changing the body. What they think as deformity now can get fixed naturally over the age. But they are restless enough to wait for the time and surgery. Badly, this addiction has increased teenage crime rate all over the world.
And I shall talk about the ethics aspects of plastic surgery. So we know, right, that people get plastic surgery because, like, one, it can be deeply ingrained into like society's beauty standards. Like the woman in Korea, like, I mean, we all know they get plastic surgery as like a high school ending gift, graduation gift, sorry. So basically, so what is the beneficence of plastic surgery? So beneficence is a principle that one ought to do and promote good for the patient while preventing harm. So basically, the plastic surgeon has a responsibility to make sure that whatever procedure that he is doing for his client, he does not hurt them. And non-maleficence dictates that a physician, or the plastic surgeon in this case, must not intentionally inflict harm on a person. This is so, we all have heard of botched up plastic surgeries from celebrities, right? So people may argue like, oh, this is it's non-maleficence because no surgeon would ever do anything to harm anyone. But the thing is, it is your responsibility as a surgeon to let your client know if that procedure that they're doing is risky, or if you are not qualified to do it, do not offer plastic surgery services. This can impact a person's life, which is why celebrities who often get botched up surgeries normally sue their plastic surgeons. To name you a few, there would be Jocelyn Wildenstein, Donatella Versace, and Tara Reid, and a lot more. Or LaToya Jackson, Tori Spelling, Lara Flynn Boyle. These are really famous women, and when they get their surgeries botched, they can sue because it is our right. Anyways, that is all from me.
Siman, I'm going to explain about deontology and theology, and then I'm going to explain about the viewpoint of deontology and theology. First of all, the theology. Deontological ethic or deontology is normative ethical theory that the morality of an action should be based on whether that action itself is right or wrong under a series of rules, rather than based on the consequence of the action. It's sometimes described as duty, obligation, or rule-based ethic. In this terminology, action is more important than the consequence. Next is theology. Theology is systematic study of nature, of divine, and more broadly of religious belief. It is taught as academic discipline, typically in university and seminar. It occupies itself in the unique content of analyzing the supernatural, but also deals with religious epistemology, ask and seek to answer the question of revelation. Revelation pertains to the acceptance of God, or deities, not only transcendent or above of the natural world, but also willing and able to interact with the natural world, and in the particular to reveal itself to humankind. The viewpoint for theology and theology about thin plastic surgery is, according to theology, no surgery should be performed on underdeveloped tin for artistic reason, and we should embrace and accept body that God gave us. On the other hand, the theology say that if the operation can save suicidal struggling teen with body image, we should do it. As valuable solution that satisfy the the principle of utilitarianism, teens should be able to correct some deformities but not those that might outgrow of. For example, breast reduction should be allowed if back problem occur in patient and disturb her daily activity, but breast augmentation should not allowed because depending on individual she might develop a breast later on. That's all from me.
I'm Valarmati Subramaniam from Section 3. Today I'm going to talk about the conflict of interest of plastic surgery for teenagers. Almost all teens and many adults are self-conscious about their bodies. Almost everyone wishes there were a thing or two that could be changed. A lot of this self-consciousness goes away with time. Ask yourself if you are considering plastic surgery because you want it for yourself or whether it's to please someone else. A person's body continues to change through the 10 years. Body parts that might appear too large or too small now can become more proportionate over time. Sometimes, for example, what seems like a big nose looks more the right size and the rest of the person's face catches up during growth. Getting in good shape through appropriate weight control and exercise can do great things for a person's looks without surgery. It's never a good idea to choose plastic surgery as a first option for something like weight loss that can be corrected in a non-surgical manner. Gastric bypass or liposuction may seem like quick and easy fix compared with sticking in a diet. Both of these procedures, however, carry far greater risk than dieting, and doctors should reserve them for extreme cases when all other options have failed. Some people emotions have really big effect on how they think they look. People who are depressed, extremely self-critical, or have a distorted view of what they really look like sometimes think that changing their looks will solve their problems. In these cases, it won't working out the emotional problem with the help of trained therapists is a better bet. In fact, many doctors won't perform plastic surgery on teens who are depressed or have other mental problems until these problems are treated first.
Assalamualaikum warahmatullahi wabarakatuh. Hi, my name is Halisa. I'm from UD Section 3. So I'll be going through the analysis of cases among the teenagers regarding their plastic surgeries. So the analysis I took is from 2013 until 2018. So from the analysis, it has stated that of the adolescents who took surgery at the 3,000 plus, and about 1,000 of them, the patients are actually below 10 years old, which we can regard from the percentage of overall, it's about 2.8% of them are adolescent, which are the teenagers who are involved in surgeries at around this. And the most of them who goes through the surgeries are actually females, which are regarding to 2,000 plus, while males are only at 700 plus. Right, so by the rate of the common surgeries, first up would be the autoplasty, and then by second it's reduction mammoplasty, and so based on aesthetic plastic surgeries data at 2015, about 1.9% of teenagers has taken over surgical and non-surgical procedure that are conducted on teenagers about 18 years old and below. And it has increased the same rate in between of 2014 and 2015. So the 1.9% was in the increase percentage from these 2 years. Major surgeries, and they are risk to that, and the risks are pretty much high regarding to the age, physical and how was the surgeries were conducted. So some of them are not quite really used to it because as you are young, your skin is considered as a baby skin, which means you have a perfect skin, but then instead the teenagers chose to go surgical procedures and stuff, so that would give an impact because your skin is growing and then causing damages to your body. So regarding to the plastic surgeries, like I said, there is many risks, so regarding age and everything. So there has been many cases of failures when it comes to surgeries, and basically teenagers can't go back in time to ask for a second chance. So that's the one time. So if the surgeon says no, which regards, they know what they say in terms of medical ethics, and the surgeon, they abide by the ethical law here, says that they do their services and make sure that they know what they do, so they won't give any sorts of kinds of injury to the patient. So to conclude overall of the analysis here, we can say that about the analysis that goes to the complications of the surgeries are about 0.91% from the year. To say that wants to go more complicated in here would be the male compared to female, as the probability of the male's complication is at 0.85 less than 1, and while for the female is 0.68 less than 1. See, one of the causes would be because due to smoking, as we know that the number of male smokers are more compared to females, so that is why it actually gives the risk when they go through the surgical procedure.